Some consumers have medical insurance and majority of them don't. When we manage the consumer, our number one priority has to be what is clinically best for them. And so this video is about how do we navigate between the clinical and financial dynamics that are at play on a daily basis in our practices. And so we're just going to go through a few scenarios or tips pertaining to how do we clinch the deal with regards to every single consumer that walks into the optometric practice. And so, number one, consumers want you to consult them and not sell to them. Your responsibility is to provide advice, show support, and give honest analysis to them to be able to make informed decisions about what they are buying from you. That's point number one that you need to understand. Point number two, consumers want you to listen to them and be able to adapt to their needs. For example, patients are more concerned about their problems being solved. Customers, on the other hand, are focused on adequate management solutions that are affordable for them, whereas clients are driven by the relationship that exists between the practice and them. What is common though with all types of consumers is excellent service delivery and experience that they get from you and that they require. Point number three, consumers want you to understand their precise needs and manage that. And this will enable you to identify the upgrade potential that exists on the current management solution and provide them with exactly that. Point number four, consumers want you to be real with them. And this is all about the kindness, genuineness, honesty, which are characteristics that bridge the gaps between you and the consumer, and they make communication between or around sales much more effective. Number five, consumers cannot assess cost effectively, but they can determine the value of what they are purchasing. What do we mean by that? They look at what will they be gaining if they go with what you're recommending versus what will they be losing if they don't. And so you have to be able to demonstrate that for them so that they can make the right decisions pertaining to their visual requirements. And so clinching the deal is not that difficult if you understand the consumer and the individual needs and are able to cater for those needs. Remember though, no matter what type of consumer that you are dealing with, patient, customer or client, excellent service delivery and experience is paramount to any sales execution that needs to take place. And so that's what you need to be doing. Spend a lot of time in the optometric practice as a team, looking at different scenarios around sales, objections that may present themselves. Oh guys, if we have this scenario, this is how we approach it. If we have that scenario, this is how we're approaching it. And you constantly as a team work on that. The more you do it, the easier it will become because you'll know that, oh, okay, this is the sales script that we have for the generation X patient, generation X customer, generation X client, and so forth. And you do it like that with each and every single type of individual that you're dealing with in the practice. And it becomes the debate around clinical and financial management of the patient much easier. And if you introduce products right at the beginning, or you start communicating the right products at the beginning of the conversation, it makes the whole conversation and the whole challenge and obstacles that may arise from that much more effective.